Welcome to the Oral Health Care Skills Web Series number 2 of 7, Tools of the Trade. I'm your facilitator, Mary Lou Vanderhorst from the Regional Geriatric Program Central in Hamilton, Ontario. I would like to welcome the presenter, Kelly Vogel, from the Halton Region Health Department in Oakville, Ontario. Hello. And knowledge broker Terry Kirkpatrick from the Seniors Health Transfer Network in Ottawa, Ontario.
Hello.
We ask that you note several items. First, no photos in this presentation may be copied, but permissions may be requested. Secondly, this is an initial presentation to be used for learning purposes, and users of this information are responsible for adaptation of this information to their practice and work environment. We have made every effort to provide you with accurate, evidence-based, and useful information. Finally, we thank Sheridan, Halton Region, and RGTC for their contributions to make possible the Oral Healthcare Skills Web Series. Kelly Vogel will now present Series 2, Tools of the Trade.
To be able to do oral care well, there are some basic supplies that are needed. These are the ones that are listed in this slide. Gloves, 4x4 gauze, toothbrush, mouth prop, denture brush, cleansing product, and dry mouth product. It is good to have everything prepared in advance. The 4x4 gauze is listed because it is preferable that since it's being used in the mouth, it is disposable. Some homes or facilities prefer to use a washcloth. If that is the case, it is important that the cloth that's chosen is used only for the mouth. Listed here are the criteria for choosing a toothbrush. Toothbrushes should always have soft bristles. The head should be small. This allows you to be more thorough with brushing. Sometimes people use a brush with a larger head, thinking that they can cover more area in a shorter space of time. However, what really happens is that areas are missed, so it is important to use a small head. Toothbrushes should be replaced once they're frayed. If they're frayed or dirty, they are no longer effective, so it is time to discard them. The cost of using this method may be a concern, and while it's true, these toothbrushes do cost more than other toothbrushes, the ones that you see in this presentation. However, in the long run, these toothbrushes will not have to be replaced as often as the inexpensive toothbrushes. The inexpensive toothbrushes do not last very long, and they are not good. So they have to be replaced more often. The effectiveness of the toothbrushes, such as what you see in this presentation, makes the cost well worth it. You'll notice the third bullet lists a wide rubber handle as one of the criteria for the toothbrushes. The reason for this is in the next slide. What you see demonstrated here is the two-toothbrush technique. Some people require this type of technique because they are not able to cooperate with the caregiver, or they may be prone to biting the caregiver. So, one toothbrush handle can be used to prop the mouth open, and the other brush can be used to brush the teeth. Since one is being used as a prop, the handle has to be large and fat enough and rubbery so that it can be gripped by the teeth without causing any discomfort, and so that it doesn't slip. Some have tried to use wedging devices or mouth props, and while dental clinics do use these for dental treatment, we do not recommend the use of them because it can be a choking hazard. Therefore, a toothbrush is the preferred tool to use as a prop to keep the mouth open, as you can maintain a good firm grip on it, as the caregiver can be minimizing the chances of choking by having that firm grip on it. Some have also used tongue depressors and wrapped hospital adhesive tape around it to use it as a mouth prop. And while the caregiver can keep a good grip on the tongue depressors, we can't overlook the fact that if it's in the mouth for an extended period of time, it can become moist due to the saliva. And if a person were to clamp down on it, it could become a choking hazard. If toothpaste is being used as a cleansing product, then only a pea-size amount is to be used. With cleansing products, it is important to recognize that if a person does not have the ability or is not cognitive, they may be swallowing the product, such as toothpaste. So if the caregiver cannot ensure cooperation from the person that they are taking care of, then they shouldn't be using toothpaste. In addition, if they cannot rinse and spit, then they might swallow it and choke on it. So only use toothpaste if they can demonstrate that they can and will rinse and spit out. If a person has dry mouth, then you may try using a toothpaste that is for dry mouth, such as the one shown in the slide. However, remember, the criteria still remains the same regarding whether or not to use that if they can rinse and spit. Paravex is another product that you see in this slide. It does not foam up like toothpaste, and the taste is very mild. You may want to consider using this as an alternative. Unfortunately, Paravex does not contain fluoride, and we know that fluoride is important to the oral health of everybody, including those in long-term care. So it is important to keep in mind that Paravex should be used for individuals that are compromised. If an individual can cooperate to rinse and spit, then they should be using fluoridated toothpaste. You'll notice that there was no dental floss in the list of basic supplies. Flossing is an extremely important part of dental care, of oral care. However, the challenges that our clientele face can make it very difficult to impossible to floss. So while nothing replaces flossing, there are alternative tools that can be used. In this slide, we can see some examples of a few different products. Stimudents and soft picks remove plaque from in between the teeth and massage the gum tissue. You may recognize the N-Tuft brush from the first slide as one of the basic tools. This toothbrush is good for cleaning along the gum line and for cleaning around the entire tooth. The pictures on the next slide will show how this tool can be used. This is an example of how an N-Tuft brush or a proxy brush can be used. For example, sometimes people have only one or two teeth at the very back of the mouth. This type of brush is small enough so it can fit all the way at the back to clean all around the tooth. It can get right in behind the tooth to clean it. This is important because cavities can start in areas that are hard to reach because they may be difficult to clean. So if we can keep those areas clean, we can help to prevent decay. Listed here are some of the basic supplies for denture care. The denture box, as shown on the upper left-hand side of the screen, is used to store dentures. Dentures should never be stored dry, as this can make them brittle. A denture brush, shown on the top left-hand side of the screen, is not a toothbrush, and it should be used to clean dentures, the denture brush. It should have a pointed side, and this pointed side is what's used for cleaning inside the denture, the side that has all the bumps and the anatomy. On the lower right side of the screen, you'll see a denture labeling kit. Dentures should always be labeled. This can be done by a dentist or a denturist. However, if the home or facility would like to, they could purchase a denture labeling kit, and then it can be done by a staff member. There are different brands, but what they all contain is essentially the same. What you would do to label a denture is you choose a location on the denture that is inconspicuous to put their name on. The denture kit contains what looks like steel wool, and you just take a little piece of it, and it's used to roughen a small surface of the denture. Then with the pencil provided, you write the name or initials, whatever can fit, of the individual on the denture. And then with the bottle that looks very similar to clear nail polish, it too is provided in the kit. You paint over the name. You let it dry, and then you paint over it again. There are various cleaning agents also that can be used, that's shown in the lower right-hand side of the screen, the last picture. You notice, though, none of them in this picture is bleach. Bleach should never be used. It is important to remember to read the label of these products and make sure that the cleaners can be used on partial dentures in addition to complete dentures. Persistent stains and deposits should be removed by a professional. So things such as iron supplement stains, those things should be removed by a professional. Also, denture paste, like we spoke about, can be used to clean the denture, because they will not scratch the denture as regular toothpaste would if it was used. A caution is that if a denture tablet is being used to clean a denture, be careful that the tablets are not left unattended, or the liquid from the denture tablet is not left unattended, because it could be dangerous if it was accidentally swallowed. All oral health supplies should be labeled. For various reasons, such as a person's taking multiple medication, or has had cancer treatment, or even has a genetic disorder, a person may have dry mouth. When a person's mouth is dry, it often appears glossy and red, and a person may complain of dryness. If you were to touch the oral tissues with a gloved hand, you'll notice that the glove will often stick to the dry tissues. Dry mouth can be very uncomfortable. So encourage the person, if they are able, to drink water. And you can also use mouth moisture agents, such as what you see displayed in the slide. These can be applied to all of the oral tissues, the tongue, the ridges, the roof of the mouth. Okay? It is also important to inform the doctor that you are using the dry mouth product, if you choose to. Whether you are using the product for dry mouth or lips, it's always important to use a product that is not petroleum-based, as this can clog the pores and it's not healthy for the tissues. So if you are using a lip balm, you want to ensure that it is a water-based product. It is not necessary to use mouthwash routinely if a mouth is clean and healthy. If you choose to use a mouthwash, use a non-alcohol-based mouthwash, as they are less likely to cause drying to the oral tissues. However, there are times when mouthwashes are recommended by oral health care professionals for various reasons. For example, a dentist may prescribe chlorhexidine. Chlorhexidine is used to treat gum disease as it reduces plaque and fights gingivitis. However, some of the side effects of prolonged use are dental staining, increased tartar, and it may alter the taste of certain foods. So you want to make sure that you use it as directed by the oral health care professional, the dentist. To aid you in the effective use of your time, it is important to use good management tools. Some examples of validated and outcome-driven management tools are the Oral Health Assessment Tool, or OHAT, and the Daily Oral Care Plan. For example, the Daily Oral Care Plan aids you in the effective use of your time by helping you to know exactly what care is needed for an individual. If you were taking care of someone for the first time or that you do not usually care for, you would know by looking at the Daily Oral Care Plan exactly what to do for them instead of wasting time trying to find out what needs to be done. These tools are effective for everybody. Oftentimes, the question arises, where can I find these tools? Well, this slide and the next are a list of where you can find the various tools of the trade. These tools, you have to know that some places may have a minimum order when ordering these tools. So you might not be able to get as small an amount as you want. You may have to go and order it in a bulk amount. This list is only a sample list of companies that provide these products. These products and others like them are also available through other companies. Thank you. This is a list of additional resources. I'd like to turn your attention to slide number 18 that highlights the Halton Oral Health link and the HoHo link, where you can also go for more information. Thank you.
I would like to thank Kelly Vogel for the Series 2 Tools of the Trade presentation. I am your facilitator, Meredith Vanderhorst, and along with Kelly Vogel and Terry Kirkpatrick, our knowledge broker, we invite you to watch one of the other 6 oral health care skills web series. Series 1, Denture Care. Series 3, Oral Health Assessment. Series 4, Basic Oral Care. Series 5, the 2 Toothbrush Technique. Series 6, Infection Control. And Series 7, Oral Hygiene Care Planning. For more information and resources, we recommend that you go to any of the websites listed on pages 2 or 3 of this presentation.